Kamiq Recruitment. We find the perfect fit for you.
Okay, let's dive right into it. This is an article from the PSI. So there's a professional conduct committee that investigates any mistakes that are reported the pharmacist makes, or any complaints that come from the public or from whatever other sources they would be from. So the Professional Conduct Committee heard a complaint in which Paralink suppositories, that's paracetamol suppositories, 500 milligrams, were supplied in error by a pharmacist for the treatment of a 1-year-old child. So the child's parent presented a prescription to the pharmacist for Tamiflu oral suspension and Motilium suppositories, and the pharmacist dispensed the prescription and counseled the parent with regard to how to administer these two medicines to the child. During this interaction, the parent also requested to buy Paralink suppositories, so paracetamol suppositories, and diarrhea sachets. So they bought these two items over the counter. They were not dispensed through the computer. They didn't have any labels on them. They were just buying them over the counter. So because these were suggested by an out-of-hours doctor, which they had attended during the night. So basically the baby didn't feel so great during the night. The parents took the baby in the middle of the night to an out-of-hours doctor, and the doctor prescribed the two items on the script and recommended the two items to be bought over the counter, the paracetamol suppositories and the diarrhea sachets. So the pharmacist counseled the child's parent, because only one of them showed up in the store, on how to use these two products. But in error, a box of Paralink 500 milligram adult suppositories was supplied. So rather than the Paralink 180 milligram suppositories, which are the appropriate strength for a 1-year-old child. So basically, while the pharmacist was chatting to the parent and instructing him regarding how to administer the medication, the pharmacist grabbed a Paralink 500 milligram suppositories, a box, instead of a box of Paralink 180 milligrams. And he didn't notice that. So he actually sold the 500, the adult version of the suppositories, to be supplied to a baby. So over the next 2 days, the child received a total of 7 Paralink suppositories, 500 milligrams, every 6 hours. So in addition to one Paralink 180 milligram suppository, which had been provided by the out-of-hours doctor just before they presented at the pharmacy. So the doctor administered one suppository, the right strength, the 180 milligrams, but in the coming hours, in the coming days, every 6 hours, the baby receives 500 milligrams of paracetamol suppositories, so 7 in total. So basically 3.5 days, 7, that would make it a day and a half, 2 days maybe in a row, that the baby got the adult dose of paracetamol instead of the baby one. The child's symptoms persisted, so they took him to the hospital, and the hospital admitted the baby. The child was diagnosed with acute liver failure caused by accidental paracetamol overdose. And unfortunately, the baby underwent an emergency liver transplant. So a simple mistake ended up in having serious consequences, and those consequences had a great impact on the child's well-being. For a baby that young to undergo liver transplant because of an error, it affected the rest of his life in a major way. So a simple mistake had pretty nasty consequences. So the important learnings from this complaint should be shared with all the pharmacy staff that you would be working with, and you can treat it as if it happened to you, or you can treat it as a serious error that could happen anytime. That's why the PSI prints these reports once they encounter a case and they reach a conclusion. They print this, and they do it in the intent that other pharmacists would learn from that mistake and organize their teams in such a way that these mistakes would not happen again. It's almost like in the airplane industry, when a plane crashes, the report has recommendations for all the other pilots to learn from the crash and take measures to make sure that a crash does not occur again from the same reasons. So that's why the PSI does this as well. And the PSI recommended that the pharmacist would have a chat with the whole team and in regards to supply of non-prescription medication for infants and children, to ensure that a similar incident does not happen in another pharmacy again. So that's why it's very important to actually learn from other people's mistakes and actually implement what we learn to make sure that in our practice we are as safe from mistakes as possible. So this complaint highlights a few learnings. Children and infants are particularly vulnerable to drug overdose and side effects. This is true even with non-prescription medicines. It is essential that extra time and care is taken to ensure the correct product is supplied and the parent or carer has accurate and detailed information regarding dosing, amount, and frequency. In these cases, supply only by the pharmacist should be considered. So basically, you should let your staff know, your OTC staff know that they need to call you for you, the pharmacist, to counsel the patient's parent or carer, and you need to oversee that the correct strength is actually given out to the patient. So that this mistake could have been done by an over-the-counter staff, and it would have still been the pharmacist that's responsible for any medication that goes out of the pharmacy. That's why you need to have a chat with your team and make sure that every time there's a baby or a child involved, even if the parent buys over-the-counter medication, you have to instruct your staff to show you the strength they're giving out, or whichever way you choose to deal with this. But you kind of have to oversee the medication that is given out over the counter from your pharmacy. because you are responsible for the correct supply of that medication as well. It should be highlighted to the parent or the carer that medicines containing paracetamol are extremely safe and highly beneficial when used correctly. So we have to assure the carer or the parent that it's safe to use medications as long as they are used in a proper manner. But we also have to say that they can be toxic and indeed fatal when used inappropriately. So therefore, it is imperative that the patient or carer are advised to always check the recommended dose for the age and weight of their child and not to give more than that. I think the report doesn't highlight this because it doesn't help the pharmacist case in any way, but the parents had a miscommunication between them, and they kind of administered the medication more often, or there was some catch to that as well. But yeah. The patient should be, the patient's parents or carer should be instructed to read the patient information leaflet inside the pack and to familiarize themselves with what the dose should be for their baby or for their child before they start administering it. So you could verbally say it that it's 180, or you should emphasize that they need to read the patient information leaflet. Now, it is recommended that you explain the directions for use to the parent or carer using the information given on the product's outer packaging or the product package leaflet, and confirm with them their understanding of this information. This can help to ensure that the correct product has been selected and identify an error that may otherwise be missed. So if you or your staff under your supervision pick up a box of, in this case, paracetamol suppositories, you have to instruct your staff to say it verbally. For your baby's age, the correct dose would be 180 milligrams, and this would have helped this mistake to be avoided, because then the parent or would have said, but that says 500 milligrams. So all these steps have to be taken to make sure that the correct medication is given out, even if it's over the counter. If you do these steps, even if a mistake does occur, the PSI will not hold anything against you, because you did take the necessary steps to actually try and prevent any mistake. You should encourage the patient to read the patient information leaflet themselves before administering the medicine to the infant or child, and if they have any queries, to contact the pharmacist or their doctor. So just make sure you emphasize that they should read it, and they can give the pharmacy a call anytime if they have any query regarding the medication. Non-prescription medicines for infants and children should be separated on the shelf from medicines for adults to help reduce the chance of them being mixed up during supply. So if paracetamol suppositories, the 180 milligrams and the 500, are one next to each other, it increases the chance of a mistake happening by grabbing the wrong box. Whereas if you know that the 180s on a different shelf and the 500s are on another shelf, it kind of helps to minimize the risk of grabbing the wrong box and giving out the wrong strength. All members of staff should be appropriately trained, and non-prescription medicines for infants and children, um, and aware that the dose needed can be dependent on age and weight. It should be clear when it is necessary to refer to the pharmacist before making a supply. So your over-the-counter staff should have a clear picture in their mind of when they actually need to involve you, the pharmacist, into that supply. Whether they need to show you the box or actually come into the dispensary and ask you to come out, or whichever way you choose, you have to instruct your staff. When you come across a baby or a child um, that a parent is collecting for or getting medication over the counter for, make sure you show me the box, or make sure you call me to come and supervise the supply. Because at the end of the day, even if you supervise the supply or not, it's still going out of the pharmacy under your supervision. So you, as the pharmacist, are still responsible for the correct supply of that medication, even if it was sold by the over-the-counter staff. In this particular case, a supply error had detrimental effects on the infant. You should consider ways in which a similar error may be prevented in your pharmacy. For example, by highlighting the information on the product's box and patient leaflet during counseling to confirm that who the product is for and what it is needed to treat. What other procedures or safeguards could you put in place? So this is where they kind of make you think about what you could do besides their recommendations. So basically, you could pull out the patient information leaflet and, with a marker, just highlight that it's a baby product, and highlight where it says appropriate dose for the baby's or age, or the child's age. This way you make sure that you oversee that you see the correct strength, and you make sure that the parent or the carer is aware of the correct strength that needs to be supplied. An error log should be completed for all errors made in the pharmacy, and the staff members involved should be informed of the error. So there is a log, basically a sheet of paper where you write the date and who was involved and who did what and how the error was made. And all members of the staff that were involved should be informed of the error. Recording errors should not be used as a way to blame individuals, but rather to encourage an environment of openness and learning, so that procedures can be reviewed and amended and practices changed to guard against similar errors happening again. So it's not what the PSI is trying to do with all these is to create
music licensing reimagined.
A way of work where it's not a blame game. It's to encourage, an environment of learning, and also openness when you do a mistake, to not try and cover it up, but to actually encourage you to come forward and say, this is what I did. Let's see what we can do about it to not happen in the future again. It's not the purpose. It's not anyone's purpose to do a blame game and to punish and to take action against. But when a PSI investigates these kind of events, it's they are way firmer. Like they come down harder on a pharmacist that tries to hide his mistake and gets discovered. whereas they are a bit more lenient with a pharmacist that was opened with his mistake, came forward and said, look, announced the doctor, announced the superintendent pharmacist, announced the parents. If you make a mistake, you have to notify all parties. You have to notify the GP, you have to notify your superintendent, you have to notify the patient, and figure out a way that never happens again. But yeah, definitely encourage an environment of openness, and especially of learning from mistakes. We as humans learn from mistakes the best, so hopefully we will learn from other people's mistakes, which is the purpose of these video series. But we will make our own mistakes, and it's important that we learn from them. An accidental pediatric paracetamol overdose was highlighted in the March 2013 PSI newsletter. So the PSI issues a newsletter in 2013 when this mistake happened. This article highlighted potential sources of error which could lead to paracetamol overdose in children, and provided advice on patient counseling when supplying pediatric paracetamol to parent or carer. So basically the PSI included this in the newsletter to let everyone know that a mistake happened. They didn't name any names, but highlighted that this error could happen again. So they just issued it to help pharmacists prevent it from happening again. That was it for that. So hopefully this video helps you guys out with putting things in order with your staff, with your team, to be able to supply paracetamol and any other over-the-counter drug in a safe manner. If you want, please comment below what was your biggest takeaway. What would you like to what would you do in the situation? What would you do to prevent it? And maybe let me know if this video was useful to you. I will definitely try and do more of these, but I will only post them in the Facebook group, so keep an eye on the Facebook group. Okay, see you guys soon. Bye.